with the recovery of sodium channels for inactive state to resting state. Is that right? So this is what we do for early after depolarization. Now we'll talk about the treatment strategy for delayed after depolarization. If you have a patient, for example, patient who are digitalized, who are using digoxin or digitoxin, right, their cells tend to develop overload of calcium, and that produces delayed after depolarization. And those delayed after depolarization may trigger the secondary upstroke, and that may be responsible for tachyarrhythmia. Let me draw the diagram. That in case of DADs, what really happens, for example, first I'm making here the normal rhythm. Right? Now, if a person has, for example, person is digitalized and calcium overloading is there, then resting membrane potential may fluctuate. These are called secondary upstrokes. These are called DADs, delayed after depolarizations. Right? Delayed after depolarization means that triggering action potential has completed its repolarization. After that, some depolarizing current is there. Now, this current is taking the threshold towards taking the membrane potential towards threshold, so it is depolarizing the membrane. As soon as these depolarizing currents, which are due to calcium overload, approach the threshold, secondary upstroke is produced. Right? Now, this part of the upstroke, part is due to calcium overloading, and this part is due to activation of which channels? Sodium channels. Is that right? Especially this part, this upstroke is due to voltage gated sodium channels. So two types of strategies can be used. In one strategy, we can reduce the calcium influx. In other strategy, we can make the sodium channel resistant to the, you can say, DADs. How we can do that? The first strategy, to reduce the calcium influx, simply give calcium channel blockers like verapamil. So patient who is digitalized, if you give him calcium channel blockers, right, then calcium overloading is slightly reduced, and these, you can say, delayed after depolarization are prevented. Am I clear? Other strategy can be used is to give a sodium channel blocker. What is the advantage of sodium channel blockers? That if you are given the sodium channel blocker, the sodium channels are blocked by the drug partially, and once they are blocked by the drug partially, then it is difficult to stimulate them. Threshold goes up, and maybe DADs do not reach up to threshold, and they do not produce, what is this, secondary upstrokes. Am I clear? Right? In this way, we can manage the patient with triggered automaticity. So up to now, what we have discussed? We have discussed the mechanism of action of antiarrhythmic drugs in the patient where tachyarrhythmias are due to abnormal impulse generation, either due to